is Jeopardy!
Hello, my name is Jenny. I'll be your host on today's Jeopardy episode. Today's episode is a COVID-19 edition, and our topic today is protein malnutrition. Let's introduce our contestants. First, we have Dacia. Next, we have Jennifer.
Hi everyone.
Let's get started into today's game. Okay, let's start off with you, Dacia.
All right, let's do miscellaneous 200.
This type of nutrient deficiency is mainly caused by a deficiency of nutrients such as protein, carbs, and fats.
What is marasmus?
What is marasmus? Correct. Marasmus is an evolving adaptation in a child facing an insufficient energy intake. Marasmus results from an imbalance of energy balance. This includes decreased energy intake, increased loss of ingested calories, such as diarrhea, increased energy expenditure, or a combination of all three. As a result, the body draws on its own stores, resulting in emaciation, which is being abnormally thin or weak. All right, next question.
All right, let's do miscellaneous again for 300.
This disorder results from severe protein deficiency.
What is kwashiorkor?
Correct. What is kwashiorkor? Kwashiorkor is defined as adequate carbohydrate consumption and decreased protein intake that leads to decreased synthesis of visceral protein. The resulting hypoalbuminemia contributes to extravascular fluid accumulation. This is known as edema. Edema results from a loss of fluid balance between hydrostatic and onclotic pressures across capillary blood vessel walls. Albumin concentration contributes to the onclonic pressure, allowing the body to keep fluids within the vasculature. All right, next question.
All right, let's do signs and symptoms for 100.
Most common symptom of protein malnutrition.
What is underweight?
What is underweight? Correct. All right, next question.
All right, let's do impact on organs and systems 200.
Effect on immune function.
What is risk of infection and delayed wound healing?
What is increased risk of infection and delayed wound healing? Correct.
All right, let's do head to toe assessment 200.
Facial appearance in patient with kwashiorkor.
I'm gonna have to get it to Jennifer.
All right.
What is round face and prominent cheeks?
Correct. What is round face and prominent cheeks? Moon face look.
Let's do prevention and treatment for 200.
Complications of protein malnutrition.
What is infections, dehydration, and circulation disorders?
What is infection, dehydration, and circulation disorders? Correct.
Let's do miscellaneous for 500.
Kwashiorkor is a sign of this immunodeficiency underlying condition.
What is human immunodeficiency virus, HIV?
Correct. What is human immunodeficiency virus, also known as HIV?
Signs and symptoms 200.
This main sign of kwashiorkor is too much fluid in the body's tissues, causing swelling under the skin.
What is edema?
That is correct. What is edema?
Let's do impact on organs and systems, 100.
Enlarged liver.
What is hepatomegaly?
What is hepatomegaly? That is correct.
Let's do head to toe for 500.
Compare the child's weight to the weight of a child of the same length, height, and sex to classify nutritional status.
I'm gonna have to give this one to Daishia.
All right. What is weight for length and height z-score?
That is correct. What is weight for length / height z-score, also known as WHZ?
All right, so a z-score is a measurement of how dispersed a relative data is from the mean within a standard deviation. It is used to assess nutritional status of a child within a population to see if they're well-nourished or malnourished. A normal range z-score is -2 or greater. A moderate malnutrition z-score is -3, less than -2. And a severe acute malnutrition z-score is less than -3.
Thank you for that. Let's move on to the next question.
All right, let's do prevention and treatment for 300.
Malnutrition Universal Screening Tool, aka MUS, identifies those at risk of developing malnutrition by incorporating
What is current BMI, history of recent unintentional weight loss, and likelihood of future weight loss?
That is correct. Current weight, BMI, history of recent unintentional weight loss, and the likelihood of future weight loss.
All right, let's do miscellaneous for 100.
These tests are ordered to measure sugar and protein in the blood.
What is urine and blood tests?
What are urine and blood tests? Correct.
All right, let's do signs and symptoms for 300.
This disorder is manifested by insufficient calories and energy.
What is what is marasmus?
That is correct. What is marasmus?
All right, let's do impact on systems for 300.
Due to pancreas atrophy, glucose levels are seen as
I'm gonna have to give this one to Jennifer.
What is hypoglycemia?
what is hypoglycemia? Correct.
Let's do head to toe for 400.
Three colored bands used to measure severe, moderate, and acute malnutrition.
What is mid-upper arm circumference?
That is correct. What is mid-upper arm circumference, MUAC?
So this is used to measure an individual's nutritional status. So you measure the straight left arm midway between the tip of the shoulder and the tip of the elbow. It defines acute malnutrition and is commonly used in children over the age of 6 months, as well as in pregnant women. So an MUAC value of less than 115 millimeters indicates severe acute malnutrition. However, if it's equal to or greater than, it indicates a moderate acute malnutrition.
Thank you for that, Jennifer. Let's move on to our next question.
Let's do prevention and treatment for 100.
This food group consists of seafood, eggs, lean meats, beans, peas, nuts, and seeds.
What is protein?
What is protein? That is correct.
Let's do miscellaneous for 400.
These regions are densely populated and are prone to natural disasters, which make people, especially children, suffer from malnutrition.
What is Africa and South Asia?
That is correct. What is Africa and South Asia? Next question.
Let's do signs and symptoms for 400.
A swelling abdomen is not due to fat accumulation, but due to water retention buildup in the stomach, causing it to expand.
What is abdominal distension?
That is correct. What is abdominal distension?
Okay, let's do impact on organs and systems for 400.
Severe malnutrition is associated with thinning of the cardiac myofibril and impairment in contractile ability.
What is reduction in cardiac output?
What is reduction in cardiac output? Correct.
Let's do head to toe assessment for 100.
The patient presents feelings of frustration or anger, often over seemingly small matters.
What is irritability?
What is irritability? That is correct.
Let's do treatment and prevention for 400.
The three management phases of marasmus.
What is resuscitation and stabilization, nutritional rehabilitation and follow-up and prevention of reoccurrence?
That is correct. What is resuscitation and stabilization, nutritional rehabilitation, and follow-up and prevention of reoccurrence?
Let's do signs and symptoms for 500.
Due to impaired nutrient absorption or impaired digestive function.
I'm gonna have to pass.
Daishia.
All right. What is diarrhea?
What is diarrhea? Correct.
All right, let's do impact on organs and systems, 500.
An emergency condition in which severe blood or other fluid loss makes the heart unable to pump enough blood to the body.
What is hypovolemic shock?
What is hypovolemic shock? That is correct. All right, next question.
Oh, let's do the toe assessment for 300.
Pathophysiology gently pinches a small section of skin above the clavicle and tenting was observed.
What is skin trigger?
I'll give it to you. What is skin trigger and dehydration?
Okay.
All right, last question.
All right, prevention and treatment.
The management phase of marasmus is the first stage of treatment. The aim of this phase is to rehydrate, prevent infection, which includes sepsis, and avoid the complications of treatment such as refeeding syndrome.
What is resuscitation and stabilization?
That is correct. Water resuscitation and stabilization. Let's tally up the point, and it looks like our winner today is Jennifer. Give her a round of applause. Thank you for joining us on this episode of Jeopardy, and we'll see you next time. I'm your host, Jenny. See ya.